Hi everybody out there, thank you so much for clicking on this video. This is Medicine on Air with Dr. Betha. Today, the second Monday in February is recognized as International Day for Epilepsy, and so I will be discussing epilepsy. Let me start by saying that 64 million persons live with epilepsy worldwide. 80% of them are found in developing countries, which include my country, Nigeria, West Africa, and Sub-Saharan Africa as a whole. Regrettably, more than 60% of those in Sub-Saharan Africa are not under medical care. And that's why we need to talk about epilepsy. There's a lot of stigma and psychosocial issues. Most of them stem from our African beliefs, and so causing a lot of myths and poor health-seeking behavior. For that reason, this video is in debunking the myths surrounding epilepsy. Number one, epilepsy is a spiritual disease. No, please. Epilepsy is not a spiritual disease. It's a medical condition affecting the brain, causing repeated seizures. Anybody can have it. Number two, epilepsy is inherited. No, epilepsy is not inherited. In more than 90% of cases, there's a small percentage where some brain diseases that lead to epilepsy could be inherited. In most cases, it's not inherited. Some of the causes include head trauma. That's a very common cause. After having a road traffic accident, having a trauma to your head from whatever source, that's a cause. Others are birth injuries in childhood. Birth injuries, especially during delivery. Others include some infections in the brain, meningitis, some parasitic infections, brain tumor, drug and alcohol abuse, metabolic problems. These are all causes of epilepsy. In most cases, it's not inherited. Number three, they consider epilepsy transferable. No, epilepsy is not a communicable disease. It's not a transferable disease. It's not an infectious disease. It can be transmitted through touching the person's saliva, urine, or blood. It can be transmitted by talking to the person, holding their hands, sitting down with the person to eat, sleeping on the same bed, or even having sex. It can be transmitted that way. It's not a communicable disease. Number four, people with epilepsy cannot excel. No, anybody with epilepsy can excel. They have intellect as normal as yours and mine. Some of them are much more intelligent than you and I. I have seen those of them who graduated as best graduating students in the department. I've seen them excel in all fields of life: medicine, accountancy, law, academics, engineering, business, and what have you. They can excel, and they are excelling. So please, every person with epilepsy, they are normal. Another one is that it's only children that have epilepsy. No. Granted, majority of them are children. A good number starts with the children. But I've told you some of the adult causes, like head trauma, like drug and alcohol abuse. So anybody, brain tumors. So anybody can have epilepsy, even an adult. Another one, they say persons with epilepsy cannot have children. No. Epilepsy has absolutely nothing to do with the reproductive tract. So anybody with epilepsy can marry, both man and woman, and have children. Another stigma is epilepsy is not treatable, it's not treated medically. No, it is treated medically. There are medications for it. My patients will ask, doctor, is there a cure? And I reply, the word is not cure, the word is control. Granted, there are some persons, after 2 or 3 years, they don't have seizures, and we stop the medications. Some others we aim at controlling, and so from having one seizure in a every day, from having one seizure a week, they now have once in 2 months, once in 5 months, once in 8 months, or even once a year. That's control. Just like you and I can have malaria or diarrhea or cough and catarrh, and it takes you out for a day or two. So they can also have a seizure, take them a day or two out, and then they continue their normal everyday life, going to school, working, running their businesses. And so epilepsy is a treatable disease, and that's what I'm talking. Let me start with the teachers. Please, when a child in your class has epilepsy or the child convulses, please don't stigmatize. Don't laugh, mock, or jeer. Teach other children not to do the same. Let the child go to school. That's the reason they're withdrawn. And if you have withdrawn your child from school, or you know anybody who has told the person, let the child go to school. If you have epilepsy out there, you haven't committed any crime, you have nothing to be ashamed of, go to the hospital, get under care, take your medications. We'll control the seizures while you excel. Thank you so much for listening. If you like this video, share. If you have questions, I'll answer them in the next video.